My name is Karthik Jonna. I'm an orthopedic surgeon here at Clear Lake Specialties in Webster, Texas, or in the Clear Lake area. My primary subspecialty is hip and knee replacement surgery. I also take care of sports medicine injuries as well as fractures. I did a special year of training in hip and knee replacement and revision surgery. That means if you were to have a hip replacement done and for whatever reason there's complications with the implants or an infection, I have the skill set where I'm able to redo that procedure and put new implants in. The same goes for knee replacement surgery. I treat conditions such as arthritis of both the hip and knees as well as fractures of the hip and knee. I also deal with a lot of infections of both joints, and I'm able to remove implants and put new implants in so that patients can have a good quality of life afterward. We've had tremendous development in the hip and knee surgery world in terms of our implants, in terms of our surgical techniques, in terms of pain management. I think patients are going home most often now the same afternoon, if not the next morning. When I was in training, patients were staying in the hospital for 2 or 3 days after a hip or knee replacement surgery. I think there are great advancements made in the design of the implants as well. I think more patients are returning to walking, recreational activities such as playing light tennis, golfing. I have a few patients that even go back to rock climbing, and these implants that we have now allow patients to return to those fun things that they like to do. I think the longevity of the implants have also gone up, where implants are expected to last anywhere from 20 to 25 years. I think also our surgical techniques have gotten way better, where incisions have gone from being 10 to 12 inches in length to now 3, 4, 5 inches at most. And I think this helps patients recover quicker because the surgical dissection is less. So I think hip and knee replacements are great surgeries. I think the success rate is anywhere from 90 to 95%, where most patients do well. And it's very gratifying for me as a surgeon where patients come in with a problem, they're not able to walk or they're limping for an extended period of time, they're not able to play with their grandkids. And after an operation and recovery after 6 or 8 weeks, most people are able to return to their normal life and very gratifying life as well. For patients, when they come to visit us here at Clear Lake Specialties, we expect a smooth visit here. We try to get you in and out as quickly as possible. We have X-ray, as well as CAT scan, ultrasound, as well as MRI in our facility. So whatever the patient's needs are, we're able to meet it fairly quickly, and we can take care of everything under one roof. What's unique about Clear Lake Specialties, we have all multi-specialties. I work closely with all of my colleagues, so whatever the patient's needs are, I can make one phone call and have them see whatever doctor that they need to see. If patients come in with a hip or knee problem, generally arthritis or other conditions of the hip or knee, we always start with conservative ways to treat them. Anti-inflammatory medications, other modalities such as injections are sometimes necessary, and we're able to do all those modalities in the office here. However, if these measures fail and surgery is necessary, then we're able to schedule them surgery expediently and get them taken care of as quickly as possible. My approach with patients is to make them feel very comfortable when they come to see me. I literally treat them like family. We joke around during the encounter. I want patients to be empowered. I want them to be the driving force behind their medical decision making. So my job is to lay out what options exist for whatever conditions they have and have them choose whatever they're comfortable doing. And I'll be just there step by step alongside with them as to make them feel comfortable and get better along the process. So my goal is just a facilitator in a way for patients to get better. So if you have any hip or knee problems or concern about any orthopedic condition, please feel free to visit us here at Clear Lake Specialties Orthopedics. We'll be happy to take care of you and make you feel comfortable while you're here.